For question 6, it asks, explain why increasing elevation causes a decrease to the oxygen delivery / uptake to the muscle. How is VO2 max affected by high altitude, and how does the cardiovascular system try to compensate for this change? So when you increase in elevation or you go to altitude, it creates a decrease in your atmospheric pressure, which overall decreases the partial pressure of oxygen. The partial pressure of oxygen decreases because even though there is the same percent of oxygen in the air, when your atmospheric pressure is lower at a higher elevation, that leads to a lower partial pressure because you take the percent oxygen times the atmospheric pressure to get your partial pressure of oxygen. And so when the atmospheric pressure is lower, that leads to a lower partial pressure of oxygen. And so this plays a role because the partial pressure difference of oxygen from the atmosphere to the lungs is similar to sea level. However, when you move from the partial pressure of lungs to the capillaries and further the blood to the muscles, the partial pressure difference between those two areas for oxygen is very low. And this is not very ideal because you want a higher partial pressure difference between these two areas to increase the amount of diffusion that will take place, because molecules want to move from a high concentration to a low concentration. So when there is a large partial pressure difference, those molecules of oxygen really want to move from one area to the next. So having a lower partial pressure of oxygen in these areas due to the lower atmospheric pressure leads to less oxygen being diffused between these areas. And therefore, since there is less oxygen being delivered from the lungs to the capillaries and further the blood to the muscles, that means less oxygen is being carried by hemoglobin, and therefore less oxygen is being delivered to the muscles, and therefore less ATP resynthesis is taking place in the muscles, so they're not able to fuel themselves as much because they don't have the oxygen in order to allow ATP resynthesis to take place. And further, when you increase altitude, your VO2 max decreases because VO2 max equation is cardiac output times arteriovenous oxygen difference. And so when you're at a higher altitude, your AVO difference decreases, and your AVO difference is the oxygen difference between your arteries and veins. And so when that decreases, that overall decreases your VO2 max. And how your cardiovascular system tries to compensate for that is it increases your cardiac output, and cardiac output is heart rate times stroke volume. And so to compensate for that, you have an increased heart rate at altitude because your heart is trying to beat faster in order to pump the same amount of blood that it was at sea level, because your stroke volume decreases at altitude, or the amount of blood that you can pump per cardiac cycle. And so your heart rate needs to increase in order to maintain or keep up with that deficit, so it's continuing to work harder. And that again is just to try and pump more oxygen throughout your body, since those partial pressure differences are so low that little oxygen is being diffused from one area to the other. And in addition to your heart rate increasing, your breathing rate also increases too, in order to try and bring in more oxygen and get rid of more carbon dioxide. And all these compensations in the cardiovascular system and a little bit of the respiratory system through breathing rate is trying to deliver more oxygen to our body because less is being delivered due to being at altitude. And it is trying to compensate because of the lower partial pressure of oxygen as well at altitude, which leads to less oxygen being able to be delivered to the working muscles. So overall, at altitude and elevation, you have a lower atmospheric pressure, which leads to a lower partial pressure of oxygen, which then cannot deliver as much oxygen to our working muscles and fuel ATP resynthesis, and our VO2 max decreases because our AVO difference decreases. And how it compensates is our cardiac output increases, our heart rate increases, our breathing rate increases, all trying to deliver more oxygen to our working muscles and body.